All right, for our online audience, welcome back. We are ready to get started with our next session of Lightning Talks. We have two presenters joining us. Come on up, don't be shy.
Good. Good. Thank you.
I'm the Deputy Director for Global Health Informatics for Okay.
There we go. Okay.
Okay. I have to start again. All right. So I was just saying hi, everyone, and thank you very much for the opportunity for us to talk about our DHIS2 work on climate health vulnerability. My name is Abdulhamid Yahaya. I'm the Deputy Director, Global Health Informatics for eHealth Africa. At eHealth Africa, what we do is quite simple. We strengthen health systems and we respond to public health emergencies, especially in vulnerable and underserved communities in Africa. So the climate health vulnerability assessment tool that we're going to be talking about today is quite key, integral to one of our core thematic area, and that's the climate adaptation in health, food security, and nutrition. We have other thematic areas: public health emergency, DPM, that's our disease prevention and monitoring, lab systems, and diagnostics. But it keys the climate adaptation, as climate assessment toolkit keys into the climate adaptation thematic area. Then it also aligns with our competency area, which is the global health informatics area. That's where we have about, sorry, I was timing myself. So that's where we have about 60 tech professionals that help to design and deploy digital health solutions. So we've worked in about 22 African countries, and we're still counting. And I think at this stage, I want to leave this yield the floor to my colleague who will take us through more details about the chart. That's the climate health assessment toolkit. But I want to leave you with one caveat. I hope you don't get too excited and say some of the things I've said in the past that I regretted a little bit. I had, after overexcitement, after my presentation in a couple of years back on how we use DHIS2 during the COVID-19 for management of electronic immunization data, I happened to end with a clause that with DHIS2 everything is possible. So I was just super excited. So after the round call died down, one elderly man at the corner now said, "Raises a young boy, I heard you say everything is possible with DHIS2. Which DHIS2 button can I press to send data to the heaven?" So I was like confused. I'm like, to heaven, data to heaven. I've never heard of that before. So just be careful what you say. Thank you very much.
Thank you, Abdulhamid. That was warming. All right, thanks very much. I think just diving into the actual presentation. My name is David Akpan, a deputy director with eHealth Africa as well, leading our technical team, and also leading some of the digital innovation ideas. Working with him closely on the informatics side. So one of the things we thought through as part of work, it's how do we respond to climate change and health, using a data to action approach. So if we then look at that, you're going to most likely be looking at it from how do we strengthen a climate health resilience within the health sector, so that they can provide the needed care as it is. We know that climate event, as it continues to happen, it also contributes to expanding, the level of health equity, which is very much a problem in Africa, and as well as also increasing disease morbidity. So that's a very something to worry. But more specifically, as we have health workers, who are actually the front line officers responding to different outbreaks, then it also means that their place of work need to be safe to be able to respond to different outbreaks as the case may be. But we see that being interrupted by climate events. So healthcare facilities are majorly affected whenever there's a climate event occurrence. You also see healthcare services are disrupted. And in that case, it means that we're actually going to be creating a lot of problem to the health response in itself. Low service uptake happens, as the case may be, and healthcare workers themselves perhaps do not have the capacity to respond to any climate health-related emergency, and that becomes challenging. Essential commodity supplies are also disrupted. So within that context, and also leaning towards WHO guideline, you see that there's so much talk about climate change impact on health, but it's less talk about health systems and facility, right? So we face a lot of, if you look down below there, we talk about all the health outcomes, how do we reduce all of that? But there's not so much talked about the smaller box there, which really is where the big problem is, because if that is affected, you will not be able to respond to all of this area of work. And that's where our work focuses on how do you strengthen health system? And within the health system, you have the health infrastructure and which the health facility sits more closely. How do we do that to make sure that our health facility proactively respond to any climate event or a potential climate event that will happen? And that gives rise to the invention of the climate health vulnerability assessment toolkit called the CHAT. You know, with University of Oslo, we've heard about CHAT, right? So this is CHAT, right? Charting the way forward. So what is CHAT? Like I did say, climate health vulnerability assessment tool is actually a digital tool developed by us, but based on the WHO climate checklist to assess vulnerability in healthcare facilities in the context of climate change. The application is operational in DHIS2 as an open source application. And of course, we have opened a contact there that if you need any form of deployment, then we should be able to provide that support. But let's go into the details. So the chart in itself, like already mentioned, is a digital tool adapted from the WHO Climate Change Health Facility Vulnerability Checklist. It was designed to evaluate resilience of health facilities to climate-related risks. We had initially developed this out of DHIS2 platform because we wanted to deploy and get some level of buy-in from the government themselves or the health facility. So at the pilot phase, we had the intention of ensuring that it allowed for scale and adaptation. We use some way of a modular design because there are several climate events that happens, and you need to make sure that you're developing a system that allows you access different, health facilities for subsequent expansion. But as time goes on, we saw the need of scalability coming in, even to other countries, and that led to developing this on a DHIS2 platform. So I could say now that the chat, it runs on the mobile version of DHIS2 and as well as the web version of DHIS2, and it gives possibility for dashboard integration. So you could have your own customized dashboard integrated into the tool, and it allows you to visualize all of what the data looks like. So in 2025, that's about this year, we had developed this solution to take care of or assess vulnerability across 3 climate events: flood, heat waves, and drought. So if this is applicable to any of the country that experienced this, then you could be able to assess your health facility vulnerability across these 3. And we're working towards covering almost about 5 additional climate event areas as well. In the nearest future, most likely this year. This is what the architecture look like we said. So based on the WHO guideline, we've built a generic metadata kit, which DHIS2 allows you to do that. And that has led to having 2 different application interface. So you have the web interface and you have the mobile interface. So you could collect data with the mobile and you run some analytics even with the web application as well. So that's allowed for usability. We're going to see the demo shortly. So how do you use chat? So when you open the chart application. Of course, it allows you know how DHIS2 will possibly require for user details, all of that. But by the time you get that, you go to the interface, it allows you to identify the climate hazard of your concern, and then you commence the assessment. The assessment is structured based on WHO guideline around these 4 domains. It assesses the health workers' capacity. It assesses their capacity around water, sanitation and hygiene, as well as waste management. It assesses their capacity around sustainable energy management, infrastructure, technology, products and processes. And then by the time you complete that, you should be able to see the level of vulnerability of that facility. And it allows for OC level assessment. And you could see that in aggregate to district, in aggregate to state, and aggregate to a country, right? As the case may be. So let's just do a quick demo. I hope the audio will allow us. Ouch, sorry. I went off the slide. I need help. Yeah, there. Yeah, we want to play video from the slide. No. From the, how did you get the slide? This, yeah. Just a 2-minute video. Oh, what happened? It's not showing now as picture. Yeah. It's converted it. But it worked from my end. Yeah, no problem. All right, I think we could proceed if we're able to get that. We can come back to it.
To play it online. Do you want me to try that?
Okay, that's fine.
Wi-Fi is.
Oh, yeah.
Here?
Yeah. Oh, required access. Okay. Oh, okay. Yeah, that's just
We
okay.
shared slides, so
Yeah.
people should be able to access.
To access the view. Makes sense. All right. So we've been told that I'm sure by the time the slides are shared, you should be able to get access to the video. However, if you haven't gotten this, please reach out to it. It will give you some accessibility to the application as well. I think it's on the decks right in front. So maybe moving on. Worked, right? So yeah, because we couldn't get to do the video, we should have shown some demo, but by the time you collect your data, based on the use case we've done in one of the states in Nigeria, this is what it's going to look like on the dashboard. So it shows you vulnerability level across all of the domains that I did mention. And from there, you could see what level of intervention is required for the different facilities. And if we want to do some drill down, this is by different domains, and the red is not like a love sign. That's danger, right? So it shows that this particular state having a health workforce that really do not have the capacity to respond to climate-related events. That's worrying. In fact, we had an issue in January where a lot of flood cases happen in the state, and the health workers were actually very much not, able to respond to different things. So that's what the dashboard looks like, but you could build what it's customized to your own, depending on what you want to see. So that's the postcard I talked about. You could access the application through that, but somehow you will require login details. Yeah, the postcard is right there. Thanks very much. And of course, the earlier slide, you could reach back to us if you want to, any form of support, chat _ DHIS2 at eHealth Africa, and then we'll provide the needed support. So that's all. Thank you. All right.
Thank you guys very much. We will make the slides available online, so everyone should be able to access that video. No worries.